Shane and Loren, welcome to the show.
Thank you. Thanks for having us, Steve.
Thank you, Steve.
Absolutely. I'm really looking forward to this conversation. Polyimide, PTFE, Filmcast Technologies, these are all top of mind right now in MedTech, right? For some of the reasons that we'll talk about. And I want to cover a couple things. I want to cover your new Filmcast Select. I think that's novel. And then you sent me some excellent samples that we'll unbox.
Great.
And by the way, thanks to Brittany for the swag. Sporting the Confluent swag here. Last time I did a podcast, this is a couple of years ago with Dean, with Joe Mullins, and Brittany sent me some swag then. So I have a good collection of Confluent swag. So thank you. So we'll go into Filmcast Select, and then we'll go through the samples. And then I want to talk about Filmcast PTFE, kind of compare it to traditional ram-extruded PTFE, the pros and cons there, the benefits, and then Tyler over PTFE. So let's get started with, I think a lot of people in MedTech are certainly familiar, well, at least you think, with polyimide. Some people don't know the PI versus the PA. Some people are confused it with nylon, at least in the extrusion world. Loren, I know you have a lot of experience in extrusion and the melt extrusion, right? Polyimide is not one of those things. It's a thermoset. It's a unique process. That's kind of one of the major differences just from a process standpoint. But polyimide with its great properties, dielectric strength, tensile modulus. I think it has the highest tensile modulus of all polymeric type materials. Scratch resistance, we see it used in neurovascular electrophysiology, but it's not one size fits all. It looks like you have some really interesting platform to kind of tailor the polyimide solution based on performance, like a minimally invasive catheter performance, lubricity, strength, durability, and also possibly from a manufacturability, right? Bonding. And then there's kind of the regulatory aspect as well. And so let's kind of tell us a little bit about Filmcast Select and some of the different inputs that a design R&D engineer can provide, and then you can provide a resulting solution for that.
Absolutely. Let's share that presentation really quickly, if that's a good time, I think.
Excellent.
So, Steve, you mentioned Filmcast Select. We want to go through just 2 slides to kind of get to what got us to Filmcast Select, and why is that important. And you may very well be very familiar with this history, but some of your audience may not. Filmcast tubing for medical device applications doesn't come into use without several important things happening in history, beginning with DuPont's introduction of Kapton varnish in 1961. At that point, it was often used in magnet wire applications for motors due to, you mentioned the dielectric strength, due to that dielectric strength, used in motors, transformers, and making the transition from coating for magnet wire applications to medical device tubing happened quite by accident, right? In the 1980s, somewhere near Chattanooga, Tennessee, there was too much oxidation on the wire, and the polyimide released from the mandrel or wire over which it's coated, and there was a tube. Fortunately, some of the team at that point had the foresight to recognize this fortuitous accident and what its applications might be. And so that's kind of led us into, film-casted tubing for medical device applications. And a lot of that originated from the same geographical area. So there's a number of players in the market in this area for that specific reason.
Okay, that's an interesting. I didn't know that story. Thanks for sharing that.
So
Just
Polyimide Valley, we call this
yeah,
Polyimide Valley.
yep.
And I think that next slide, Loren, will tell a little bit about why, from a Confluent perspective, from a Confluent Chattanooga perspective, why we wanted to kind of differentiate ourselves and how we wanted to do that. So, yeah, a lot of players, and a number of spinoffs from that original nucleation point. A lot of them still providing material offerings using those very same processes and those very same materials from the 1980s.
Okay.
We have significant Filmcast experience over the years. We're working with this team here with, I myself have 20 years of experience, but we have people in our team in that same range or even higher. We knew when we came together that we would need to do something different in order to be successful because there were so many players. And so our approach, Steve, has been an innovative approach. So we've got all these players, most of which are still doing the same thing from the 1980s. And when we got together in December 2020, we decided that we needed to innovate. So we started innovating right away. We put our first Filmcast product in the market in July of 2021. And by 2023, we had introduced 2 innovations to Filmcast, including the largest PTFE, which is a challenge due to the fragile nature of the material and the large mandrel that you have to put it over and the rollers that it has to traverse. So it makes it very challenging. And then we also launched REACH compliant polyimide in June of 2023. So we'll talk a little bit more about REACH compliant polyimide. We continued in April of 2024. You mentioned tie layers. So just like polyimide, the typical polyimide is not REACH compliant. Typical TPUs as tie layers are also not REACH compliant. So we used what we learned to release REACH compliant TPU tie layers to the market. Probably our biggest innovation to date was the launch of Ultra Polyimide. You talked about why polyimide is useful, and one of the main uses is its strength. And Loren will go into some of the actual data and comparisons, but Ultra Polyimide is twice as strong as industry standard polyimide. So if you want strength, Ultra Polyimide has it. And so that brings us to Filmcast Select. So the Filmcast Select is our newest offering, and really it's a system that helps bring all this innovation together. And Loren will talk more about that.
Okay, great.
Great. Thank you, Shane. And I think, that's really an important point. We've got all this different innovations and materials, and versus having, an offering here, an offering there, and there's a little bit of innovation, on this side. It's more about how do we bring that all together into a useful system for a customer to be able to leverage what we offer and what we know to really improve their positioning in the market. And so at its high level, Filmcast Select is a material customization program that allows them to intentionally select materials for a particular application device. And so step 1, the customer select critical performance characteristic for that. So in terms of neurovascular, it might be flexibility. Whereas if you're doing something structural heart related, you might need more strength, right? The ability to have a little bit more pushability. Then in step 2, we work with the customer to select the material or materials from our portfolio that are best suited to enhance that desired performance characteristic. And then finally in step 3, it's where we present those options to the customer along with the tools and the experience that we have. So we leverage all that, bring those options to the customer. They can select the optimized design, the one that's the most useful for them in the situation.
Okay, excellent.
within that, there are, and as she already kind of alluded to, we've got several different innovations, and then they can really be divided up into primarily the polyimide innovation or the PTFE innovations. So the polyimide offerings that we have the standard polyimide. So this is the same PMDA, ODA backbone, the same historical polyimide, that very well known in the industry, and it's highly transparent. We can make that, and we can, that's not a problem if that's what the customer needs, right? But as far as innovations go, whenever we do the REACH compliance, which I believe Shane will talk about a little bit more later, we have two options if you really want REACH compliant polyimide. And so the two options are glossy, which is basically, it's the same PMVA ODA backbone as the standard polyimide, but it's REACH compliant. So it looks almost identical. You would be very hard pressed to tell the difference between the two. It's the same polymer at the end of the day. It just is made with a solvent that's REACH compliant.
Okay.
So there's no trying to get a non-REACH compliant solvent totally removed from the system and then trying to do some validations on the front end. The other option that we offer of the REACH compliant polyimide is a matte finish. And so that is basically micro-textured on the OD to enhance lubricity and bonding.
Okay.
So that micro-texturing enables people to be able to pull just a single polyimide tube bundle very easily. If you get a long tube and you've got a big bundle of them, you can just pull one out. You can't really do that very easily with standard polyimide. So it's helpful from a handling perspective. It's helpful for a bond perspective. All those little undulations on the surface gives you more surface area, kind of a mechanical bond. One of our customers was actually not able to get glue to come off of it at all. So that's, and for them, it was a negative. For other people, that's a very good positive, right? So very, very good possibilities there if you want to, if it works for the situation that the customer is in. Then finally, as Shane's already mentioned, Ultra Polyimide, which has quite the amount of ultimate tensile strength and is still REACH compliant.
Okay.
Actually have done a little bit of testing on that, but I'm going to actually flip it over to Shane for the REACH compliance.
Great. Yeah, I'm very interested to learn about it, and it sounds like it. I'll let you talk, but it's the solution that they're using is REACH compliant, right?
That's right, the solvent.
Yeah,
So
solvent.
the typical solvent for standard polyimide used throughout the industry, Steve,
Yeah.
is NMP, which is a REACH restricted solvent. So as you guys are aware, and you're probably most of your audience at this point, REACH is an EU regulation that imposes limitations on how much certain restricted materials can be contained in products that are sold in the EU. So different competitors have different approaches to how they handle this REACH compliant requirement. Most or pretty much all that we're aware of are using the standard REACH restricted solvent and working through processes to subsequently remove it through post-processing, things like that. But that can be time-consuming. It requires periodic testing, validation. So that's a burden on the producer as well as the customer. And you also can have lot-to-lot variability. So just because you've shown that if I bake it for so long, I can get under the limit with this, that may not be the case in the next lot. So we wanted to simplify it for ourselves, simplify it for our customers, make it as effective and efficient and cost effective as we could. So we just removed the REACH restricted solvent.
Okay.
So we don't use a REACH restricted solvent. There's no need for testing, validation, all that from ourselves or our customers because it wasn't there to begin with. So
Right.
we feel like that's a simple approach for everyone.
Okay.
And like you mentioned early on, and Loren's touched on in his summary, we have two options within our REACH compliant polyimide, our matte finish and our glossy finish. The glossy finish for optical clarity, very similar, almost indistinguishable from standard polyimide that your customers, your listeners are used to. And then the matte finish for the added lubricity and bonding. And I think we've got a little bit more about the matte finish on the next slide, just so you can see the micro texturing that Loren mentioned.
Excellent.
So this is a picture of our REACH compliant polyimide with a matte finish, and you can see the micro textured surface. So like Loren said, we've had customers who love this because of ease of handling. If you have operators handling a lot of tubes, and you try to pull a couple tubes from a bundle, I'm not sure if you've seen it, but you can get a spaghetti mess very quickly with polyimide because it doesn't like to slide by itself.
Okay.
This material is completely different. You can easily pull a couple pieces out of a bundle. So some customers love that, and like Loren said, some customers have preferred it due to bonding benefits, due to the micro texturing on the outer surface. And this is not a mechanical process that we do. It's a property of the polyimide itself.
Oh, interesting. Okay. Yeah, I was figuring it was some kind of mechanical texturing.
No.
One of the things that Loren mentioned beyond the handling and mechanical bonding is, it made me think, I guess, the lower friction, right? Because maybe there's kind of peaks and valleys, maybe less surface contact. Is that the solution there?
Yes, and that is what allows the tubes to slide by each other and results in the easier handling for our customers who are using it like in large volume assembly processes. And Loren's going to talk a little bit more about the specific properties of Ultra Polyimide and then some of the PTFEs.
Definitely. Okay. I mean, yeah, just to interlude here, polyimide, as we talked about, has such high mechanical properties already. It's amazing that you can 2x. So I'm really interested to hear about this, and the image on the right kind of tells you some of the benefits related to profile, right?
Exactly. So Ultra Polyimide is Confluent exclusive REACH compliant polyimide. And it has, as you can see on the graph there on the left, about 2x tensile strength as standard polyimide. And so we typically will present this as an option for, as you can see on the graphic on your right, about keeping the same strength, but having a lesser wall thickness. So increasing your real estate, so to speak, the usable real estate that you have in the catheter, whether it be on the OD or the ID, right? We can also, however, you can still use the other coin, which is where you want to increase catheter strength. You can do that without reaching the wall thickness. You just have Ultra in place of the regular polyimide. So actually, we've been continuing to do more in testing, and the most recent data that we have shows that it has about almost 3x the elastic modulus as standard polyimide. So in the place where most people would use it in their device, it's not just 2x; it's almost 3.
Wow.
I mean, just an exclusive reveal here on your chip here.
Yeah.
That's hot off the presses, Steve.
Okay, that's interesting. Wow. And it's still the wall thickness, the low end of the wall thickness is still like 3/10 or something as compared to standard.
Yeah. So on this one, you really could go with thinner walls. So I would say it's probably 3/10 depending on the.
Yeah.
But whenever you get to larger sizes, you can continue to have thin walls with a volume that you can't have with standard, because it's able to be removed from the mandrel and still keep its cohesiveness because of that higher strength that it has.
Gotcha.
It was surprising to some of our processing techs whenever they started pulling some very thin wall samples of Ultra for the first time.
Yeah. the durability.
Mhm.
Okay, excellent.
Let's see. And so kind of flip a little bit now. So that's kind of our polyimide offering. So to go to our PTFE side, we have a variety of dispersions here that we use. And so the Flexicast, the Duracast, and the Ultracast. So our Flexicast PTFE has more flexibility and more than twice the amount of elongation than ram-extruded PTFE. So something that you were speaking to a little bit earlier, right? Ability. Duracast, that option has higher abrasion resistance than does Flexicast PTFE. So it helps withstand repetitive tooling passes or device exchanges as needed in a particular application for a customer. And finally, the Ultracast option has a slightly higher ultimate tensile strength than our Duracast PTFE. And so this can be helpful if you have a small stent for delivery and deployment. This one's really the balance between Filmcast flexibility and strength. Let's see here. And we also can, if needed, and if the customer has existing biocompatibility data for a different grade or dispersion or what have you of PTFE, we can also take that into our process and be able to use that. And so that saves time, right? And money, so that on a next generation device, if they don't want to go with one of our options, we have the ability to mimic what they've already been getting, so they don't have to repeat any biocompatibility testing.
Quick question. Circle back to
absolutely.
the Dura and Ultra, and you mentioned stent delivery, and I know that Confluent is a major provider of nitinol solutions as well, including implantable stents, right? A stent that's crimped and loaded into a sheath, right? There's a lot of radial force within that sheath. I had a sample catheter once. I think it was a carotid delivery system, and you could tell the color of the sheath. It was polyimide, it must have been. But I was thinking about that radial force. Depending on the radial force, it could dig into the sheath and affect deployment. Is that kind of where you were headed with that as an example?
That's it. That's right. Although
Okay.
as those radial forces increase, they want to dig into the soft poly PTFE.
Yeah.
And whenever you avoid that, if you have a lesser strength PTFE, it can cause that to just wrinkle up and cause deployment issues. So, of course, we're still dealing with PTFE here, right? We've not transformed PTFE into polyimide somehow, or just steel, but it's definitely there's a increased resistance there to help for those exact situations.
Okay. Thank you.
And so, Filmcast Select, just kind of as a summary here, it's the 3-step program that lets the customer select the performance characteristics that they want to amplify by providing a multiplicity of options in a material portfolio and partnering with them to select the solution that's optimized for their application and their situation. One size fits all, right? It's no longer efficient for the medical device industry. We want to make sure that we offer a lot of different options so that one of those options, at least one, will give the customer the edge that they need in the competitive market to put their device a little bit in front of everybody else's.
Absolutely. That's interesting. It's all about being able to customize, right? And to meet the challenges of the tortuous anatomy or the therapy and manufacturability. And it looks like you provided a solution for some customers and R&D engineers to kind of fine tune the solution for their application. That's excellent.
That's what we're hoping for. And we're going to continue, we have other innovations that we're working on, and we will just kind of incorporate those into the Filmcast Select program. So we're hoping our customers find some benefit in this approach.
Okay. Excellent. Thanks for going over that. That's a great solution. To kind of make it even more interesting, we have some included samples that you provided that we can go through that kind of match some of those options, right, on Select. And if it's okay with you, Nice package, by the way. Thanks to your marketing person, Brittany. Let's start with kind of the industry standard that we talked about, polyimide. And this is a sample. I'm going to round off 65 thou ID by 68 thou with a 1.5 thou wall. And anybody that is familiar with polyimide kind of knows these colors, right? But you kind of gave an interesting timeline in the beginning. You started this venture. I know you have a lot more experience in polyimide than starting in 2020, but that's when this operation started, right?
Exactly. Yes.
Okay.
We do have significantly more experience, 20 years or so, but we started Confluent Chattanooga in 2020 as an opportunity to take the experience that we all had and the clean slate and the benefit of being able to say, if we knew what we knew and could do anything that we wanted to do, what would we do? And that's a benefit that a lot of companies don't have, right? And so that's allowed us to be able to innovate quickly and do things a little bit differently than others in the business currently do them.
Especially in a regulated environment,
That's
right?
right.
It's like you're stuck. There's very little that you can change. Your customers don't want you to change, but when you can start with a clean slate, you have a lot of options. That's a good point. Appreciate you mentioning that. All right, so then let's move on. We have 2 samples that are REACH compliant. Again, let's see, this is a 65 thou ID with a 68 thou glossy, so a 1.5 thou wall. This is the glossy finish that is, as I think Loren mentioned, similar kind of gloss to the standard, right?
That's correct. Yes. If you hold those 2 up side by side, there should be very little visible difference.
Okay. Yeah. I don't even know which is which.
That's the intention.
I do. Yeah. Okay.
If you want a REACH compliant option to substitute in for your non-REACH compliant polyimide industry standard, this is the way to go if you already have something moving further along in the pipeline.
Okay. Now I'm excited to kind of compare the matte, same size, both REACH compliant, but matte. And I guess you can't really tell just by the hand, right? Maybe it's more, is it more microscopic? Let me see.
Did we send him a large one?
They're both the same. Oh yeah, I could feel a little bit. You can feel a little bit, yeah.
You can especially feel it, we're making some of the largest polyimide in the industry at 130.
Yeah.
And you can definitely feel it on the larger polyimide tubes, but you can typically feel it on the smaller ones too, a little bit.
Yeah, imagine. And that was a great point you made earlier about the largest. Because it's very difficult. It's a lot of material, first of all, right? The core. And it's going around shibs and rollers and things like that. It's hard to handle the flexibility. You figured out there's some secret sauce there that you figured out. It's a good job to going on the higher end, especially, I don't know, maybe it's structural heart or whatever the application is to go larger.
Yeah, a lot of times it's neurovascular aspiration catheters that like the PTFE at the larger sizes.
Yeah.
Different applications for polyimide on the larger sizes, but the more challenging bit of that is probably the PTFE due to the fragile nature of it, but they like it because it's flexible for tortuous anatomy in the brain, but they also need that large lumen for the aspiration of the clot for stroke treatment.
So that's a great point, Shane. I would think that the Ultra, because you could lower the profile and have more inner lumen for aspiration, right? You can a larger hull, so to speak.
Well, the challenge with the neurovascular applications, and I'll let Loren can chime in if he wants if I miss something, but you need a lot of flexibility in the brain.
Yeah.
And so sometimes polyimide may not be your best option. PTFE is it's what we find our customers need most often. They need really soft materials, you know, without more kink resistance, more flexibility.
Yeah.
That might be a trade-off that you have to make and not go the polyimide route, but the PTFE route.
Okay. Yeah, that makes sense. I remember having a podcast with somebody about neurovascular, and it's like the catheter technology. It's like you need a wet noodle,
Okay,
right?
exactly,
Almost
exactly.
to navigate the tortuosity. Okay. All right. So then we had this, the reach. This is a 42 thou by 44 thou, 1 thou wall thickness, ultra polyimide, 3x higher, I think, tensile modulus. Did I hear that?
That's right. That's right.
Yeah, it's amazing.
The standard,
Hot off the press.
the standard polyimide elastic modulus is around 310 KSI. And Ultra was right about 900 KSI.
Okay.
So
Excellent.
a lot of resistance there to being pushed around. It really wants to, it'll do the pushing.
Yeah.
So to your point, Steve, you can go thinner walls and get the same performance, or you can keep the same wall and get more strength. And so we find customers interested in both approaches. It's not always that they want the thinner wall, but in some cases they do for more real estate to make for tool passages or other parts of the design. But we find some who are like, we want it to be as strong as possible. How can you help us make it stronger? We can't Filmcast peak, but Ultra Polyimide is a very good option in that case.
Okay. Excellent. Thanks for going through those. That was interesting. The selection there from standard, reach compliant, glossy, matte, and of course ultra. Really interesting tech platform. So many different applications. I'm sure that it's being widely regarded by your customer base. Let's move on to PTFE, and there's a lot of talk about PTFE in the industry. We have an exception right now for PFAS, but some of the talk about, like when there was a lot of talk about alternatives and these lubricious compounds, I think one of the things that people forgot about is profile. We talked about profile, right? Profile is king in catheters. And Loren, you're an extrusion person, right? And it's very difficult to extrude those lubricious compounds down to the wall thicknesses of even ram-extruded, a thou and a half. It's very difficult to repeatedly extrude that material, and forget about, right, a Filmcast solution, which is ultra low profile, right? Maybe down to 3/10 or something we talked about. So just kind of want to talk about the comparison a little bit between Filmcast and ram extrusion of PTFE. There's benefits on both sides, right? But just kind of give us a little comparison there.
Sounds like a perfect question for Loren since he lives in both universes.
Yeah.
Yep. Wherever I misstepped, you just fill in there, Shane. But yeah, you're absolutely right. Even in that in that application, right? In any application, it's still not a one size fits all. So there are times where Filmcast PTFE makes absolutely the most sense, and it's a slam dunk, right? And there's going to be other times where it's not. The ram extrusion is going to be the way to go. They're very complementary. The strengths of Filmcast are the weaknesses of extrusion, and the weaknesses of Filmcast are the strengths of extrusion. So they go together fantastically. So kind of just explain that a little bit more. Filmcast is excellent at very thin layers, right? That's how it's built up in very thin layers. So it's built up on a mandrel on the wires, as Shane was talking about earlier. And so it has that supporting mandrel the whole way through. So you're able to get very, very, very thin layers. And that's just not possible whenever you start doing ram extrusion because there is no supporting mandrel. There's nothing there to kind of keep that profile or keep it supported. You're primarily on air. I've heard of people trying to get, okay, can we do the ram extrusion over a wire? And even still, just because of the pressures that are involved, it's just very difficult to do. It's just not how extrusion is here. Now,
yes.
On the flip side of that, like I said, the strength of Filmcast is the weakness of extrusion, and their weakness the Filmcast is the strength of extrusion. You have applications where you might need a thicker PTFE wall, very thick. And so once you start getting over about 2 mils in the PTFE Filmcast world, it starts to get a little bit more difficult. We're starting to have to, put on maybe multiple oven runs. It just gets a little bit more unwieldy. And that's something that can be done very quickly in a ram extruding process. So from a processing side, you can see that those, which is where I live primarily, right? You can see that there's different times where those can be advantageous. But then on the use side, just some of the way that the ram extrusion, not just during the ram extrusion, but some of the post extrusion processes that it goes through, you get a very PTFE rigid structure. And sometimes, and particularly in those neurovascular applications where you need that wet spaghetti noodle kind of physiology, you really need it to be as flexible as possible. And that's where, again, Filmcast, because of the processes that we send it through, not quite as stiff. And so that gives it the ability to have, that it can just go around tortuous anatomy very simply. It's really preferred in those neurovascular applications where you really, I don't know about you, but I don't want anything up here that's going to be super stiff and making its own pathway, right? I want it to follow the paths that are already there. So again, where those are advantageous, but I guess even just to say one more, we talked about stent delivery, right? And so with really big stents that are they have a lot of radial force, but you maybe can't go to polyimide yet. Might be, there's a time where that ram-extruded PTFE is going to give you that extra resistance to try to make sure that you can still deploy that stent. That's something that we're working on. That the UltraCast was that first step down that path to try to get us to where we could have the same exact strength as RAM. We're not quite there yet, but we recognize that's a need in the industry, and that's something that we would love to be able to support our customers with, provide them, again, just another option, right? That multiplicity of options is where you're going to find your best solution. If everybody's pigeonholed into just one material type or one process, there's no differentiation. There's no innovation. But the ability to have multiple different options that you can choose from, that's where innovation lives. That's where you can mix and match to get the optimal solution.
I love it. On PTFE, it has so many great properties, but one of them is, it doesn't, you can't bond dirty. The adhesion strength is terrible, right? That's why it's such a low coefficient of friction and things like that, right? But there's secondary processes, or maybe sometimes inline, I guess, but the chemical etching, right, to enhance the surface so that you can bond an outer jacket material, PBAX, TPU, whatever it might be, nylon 12. But sometimes that's not enough, right? And there's this tie layer technology. If you can kind of talk a little bit about that, I would assume that the wall thickness on the tie layer is so thin that you probably can't even measure it, maybe, but they're very difficult to measure. But can you get a little bit into tie layer technology?
I don't mind starting off with this one, Shane, and then you can take over if that works for you.
Okay, sounds good.
So to kind of start at a base level, the etching that's done, right, to make PTFE bondable, it has an expiration date on it. There is a certain amount of time where if there's not bonds made, then the PTFE will, and this sounds funky, but it almost heal itself, so to speak. And basically my understanding is those fluoropolymer chains are going to rotate to expose the fluorine ion back to the surface. So what we do is very efficient. We've got contact angle measurement systems here that we can make sure that our etching is sufficient. So we can ensure, we've got that surface energy where we want it to be. We can get good bonds, but we can provide the material with a tie layer on top of that to try to ensure that etchant won't expire, right? you're immediately, or within just the next few days, you're putting a tile layer on top of that PTFE. So you're not giving time for the PTFE to undo the etch that we've done. And so that in itself is a very positive factor whenever you're considering, why would I want a tile layer over an etched PTFE, is that, well, if it's there, it's going to be whenever the etch is at its strongest. So you have the best lamination, and you don't have any concerns about that etch expiring over time.
So you encapsulate it and kind of
Sure.
lock in the properties.
That's it.
Okay. Excellent.
Yeah, I think Loren's pretty much touched on everything with that, but the options with the tile layers would be the same thermoplastic outer jackets that we would offer in other applications. So your P-Baxes, your nylons, various TPUs. We will sometimes even do 2 different durometer tile layer passes, one that maybe is softer for the first pass, and then one that's slightly higher durometer for handling to prevent damage.
Gotcha.
For the second. So typically it's 1 to 2 passes with maybe 1 to 3 passes, with each being like a 10,000ths layer. So very thin.
Okay.
But the very same options that you would offer for other thermoplastic outer jackets.
That kind of, it goes more into the, not select maybe, but possibly, but just more options, right? You need the flexibility of a TPU on that, but handling a TPU,
Exactly.
The tackiness, you can kind of take care of that with a higher durometer nylon or a higher durometer P-Bax. Gotcha.
Or even a higher durometer TPU.
Yeah.
A softer
Okay.
one, and then maybe a higher durometer one for subsequent
interesting.
pass. So yeah, lots of options.
Okay. Yeah. Wow, Loren and Shane, this has been a great conversation. I appreciate your time. This has been really interesting.
Thank you for having us. We know that you're busy and your audience is busy, so we appreciate the opportunity to come talk about what we think is exciting stuff that we're doing and the innovation in the Filmcast area.
I think it's exciting as well. Loren?
Yes. Thank you, guys. Really appreciate the time. It's been a pleasure.
Okay. All right. Thanks.
Take care.